most famous physical therapist on the internet.
All right. Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together, we are the most famous physical therapists on the internet.
In our opinion, of course,
You try
Bob.
saying that fast, Brad. Today, we're going to talk about how do you determine directional specific exercises to stop sciatica and low back pain?
Right, and that's not a question. We're actually going to show you how you determine
We're
it.
going to provide the answers.
Right, directional exercises are not new by any means. McKenzie, Stuart McGill, there's a number of great therapists, including Bob and Brad, who always use this, not always, but usually use this for exercise for back problems.
Yeah, we're really humble too. So, by the way, if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also, go to bobandbrad.com. Go to the giveaway section because we're always giving something away.
That's right.
This week, we're giving away, actually, the Thick Light. I'll show it to you in just a minute here. You can also go to Facebook. It'll be pinned to the top of the page. Twitter, Instagram, TikTok, if you want a 60-second version of our program. I guess, Instagram. Also, we have what?
Great clips or short clips on the YouTube and the podcast.
Yeah, we're everywhere.
Wonderful.
So here is the Thick Light. What's nice about this, you can actually use this in bed too if you have to. All right, here we are with the Thick Glide on the floor in the seated position, and we've got the little stilt up there, the little stand.
Elevates it.
Yep, and you can work it that way. You can work it flat. And of course, you can spin it around and actually work it with the other direction so it works more hamstrings.
Incline, decline, or the flat.
I'll tell you, it's great for underneath a desk.
It is.
Yeah, because you don't bump your knees up against the desk like you would with a bike.
Yeah, so as it's going, the desk keeps bouncing away in the computer. And yeah, that's no good.
All right, Brad, let's get talking here.
Okay, directional specific exercises. As I mentioned before, they're not uncommon. As a matter of fact, in 2012, there was a study by Manual Therapy Journal. They did a systematic review, so they took 62 studies and looked them all over, and they came out with very positive reports using directional exercises, especially associated with centralization of symptoms. In other words, with sciatica, where you have non-distingling pain in the back running down the leg. When it centralizes, we're looking for the symptoms to go up towards the back. So
it's going out of the leg, but it's coming up. You feel maybe even a little more tense,
right,
up in the buttock or back, but it's getting better then.
Exactly. And the directional specific exercises are a key point of getting centralization. So how can you do it at home? And we're going to show you some of the tricks that we use from going to our experts and from our experience.
Yeah, we're not going to do too much detail here, Brad. We're just kind of giving a broad brush overview of it so you can look into it more. We'll talk about that later on how to look into it more.
Exactly. We're going to give a good kind of a case history, a typical case history may work for you. But we're going to give you some options for the details of your situation, and so you can also get this down pat.
So you first need to really determine, Brad, whether or not you are having more pain with flexion or extension.
Right.
Correct?
Those are the two directions that oftentimes are the problem.
Sure.
And so as therapists, what we do is I'll ask my patients and I'll write it down, or I'll have them write it down. I need a list of activities or postures that make the pain worse, and then that make it better, and sometimes they'll say, well, everything makes it worse, which I understand. I've had severe back pain myself, but you need to step back, and there's some that irritate it more, and some not so much. So I've got a list here. This is kind of a typical list that someone may come up with. So we got posture or movements, things that make this back pain or the sciatica worse. Sitting, but not so much right away, but greater than 10 minutes.
Sure.
Okay, that's not unusual. Brushing teeth. And you might wonder, what does brushing teeth have to do with it? Most people, when they brush their teeth, they're leaning forward. And that little bit of back flexion, we have to be aware of.
Yeah, if you're brushing your teeth with your back straight, it probably is not going to affect your back. But
so then we look at that. So typically, people are leaning forward without even being aware of it. And then any bending to lift anything up, even if it's a pencil, that seems to make it worse for this person. What kind of things make it better? Well, walking seems to not bother it.
For
Even
sure.
if it doesn't make it better, but it doesn't irritate it, that's going to go in the better section.
Sure.
And also sitting in a firm upright chair seems to be better.
Instead of slouching into like a soft chair, like a recliner.
Your car seat. Sometimes those are not very good as far as that. Standing tall, it seems to be better than if I'm going forward, kind of like brushing the teeth.
Yeah.
So we're coming up for some pretty good information just from here. And you may not be aware of this, but as therapists, we realize that while sitting, your back is flexed forward like bending. Brushing your teeth is the same. And of course, bending is that. Now, walking, you're more upright. Puts the back more into extension. Sitting in a firm chair usually helps get you more upright. And of course, standing tall. So this is all good information, but we're going to go one more step to specify.
So this is all indicative of someone who's having trouble with flexion intolerant.
Right.
They're
in
not
other words,
good on flexion.
Yep. In other words, bending forward. And sitting is something that a lot of people don't realize.
Right. It's a real killer.
It's the same as bending forward.
And the problem with it is you're bending forward for a long time.
Yes.
And those forces can be much worse than the quick lift.
Right. Oh, absolutely. And that's a big key. Now, what we can do next, Bob, you want to lie down?
Oh, sure. Wow.
I did. Yeah. See, I've been working on my grammar.
Yeah.
My English. Karen, or is that her name? That was very.
Karen.
She would be very proud of me. All right, so what we can do to kind of confirm what we're already thinking about, which direction to stretch forward or backwards, is we're going to do a flexion activity, which may not seem like a flexion if you're not aware of it, but bringing both knees to your back actually flexes your low back.
You can do like repeated ones in a row.
Yep.
Like 10 in a row.
Yep.
To see if that starts making your back pain worse or your leg pain worse.
Right.
Now, if it does, stop.
Yes. If you go, I've had people go 1 or 2 times and it's not comfortable.
Right.
And I just say, okay, that's enough.
Just getting up in this position. They don't like it.
Sometimes they might do it. It's not till like 6 or 7 and it just starts to irritate the back or the leg. Then we put a hold on that. And then we have the person lie on their stomach. Oh, Bob. Tough weekend,
grunting,
huh? Yep. Now, sometimes if the back's pretty sore or the leg, we start with a pillow underneath. Here.
It might be too much for the back to tolerate going into even neutral or extension right away.
And a key point is, I'm sorry, Bob, sometimes you don't need the pillow, but at first it's uncomfortable, but it's important that you just relax her for, 20, 30 seconds, because with some time things can mellow out and it's like a little uncomfortable at first, but after a little bit, it feels okay.
You might even need 2 pillows.
Yep.
I started with my nephew and it took 2 pillows.
Right.
But it calmed down then. And then eventually you can work the pillows away.
Right.
And just try lying flat like this.
And, we had mentioned we want to work the back into extension is what we're thinking.
This way.
And we're going to confirm that now. So, Bob, can you go up on your elbows a little bit?
That would be the next thing is just try elbows. Even could bring your chin up like this too.
All that helps extend the back. Now, if your back pain or sciatica is not too bad, you might be able to go into the press-ups right away. Or you might have to take your time and just see if...
Hands beneath the shoulders.
Yep.
And I'm just doing micro press-ups here.
Baby ones.
Baby ones, yep.
The first one, if it hurts a little bit, just go back down and try 2 or 3.
Yep.
If it improves with numbers, keep going with it. If it makes the leg pain worse, then maybe not.
Yeah, now the key is don't lift up the pelvis like this.
Right.
All the movement should be coming from the back. You want to have the back nice and relaxed in order to get movement there. Because if you go like this, you're not getting any back movement whatsoever.
We're not getting that. So let's say lying on your back, pulling your knees to your chest, irritates it. Prone, after you lay there for a little bit, you can start to do some press-ups. It's feeling better. And I've had patients get up and they feel good after that. And, I'm smiling because I know they're going to get better with their exercises. So then what they're going to do for the home exercise program, the directional specific is important, which is the prone press-ups. Were you looking for something, Bob?
Well, I was looking for the pillow for support. I was going to
yeah. Well, we got it right here. But you need to avoid the sitting because that irritates it. Remember the
Yes.
list. So we're going to avoid these things that make it worse. We're going to avoid the long-term sitting, particularly in a slouchy,
Now again,
uncomfortable
with this
chair.
video, we're specifically only talking about people who are having trouble with flexion. Because some
Right.
people have trouble with the other direction,
Right.
extension.
And-
That's a whole different video.
Right. And we've got options. We got some videos we're going to
Right.
direct you to so you don't have to search the whole world over on
Yeah.
the internet in just a second. But we're going to also avoid brushing your teeth. Actually, brush them nice and tall.
Yeah.
And
Get the toothpaste all over your body.
exactly.
Yeah.
And then bending. We're not going to bend like this anymore. Everything is going to be like
all
this.
the hips are taking the movement.
Yep. Right
So-
in there. Perfect
And
posture.
sitting, you want to sit. You want to avoid sitting, really, if you can.
Mhm.
But there's sometimes it's unavoidable, like driving a car. Even though you want to limit how much you drive a car,
Yep.
if you can. But when you do, you definitely want to have some support there
Right.
in the low back to keep a little bit of an arch there,
Mhm.
so you're not routed out flexed the whole
Right,
time. So
right. And then we're going to go back to the exercises probably every couple hours where Bob demonstrated laying and doing the press ups, going up as high as you can, 10 repetitions, and then take a break and come back in a couple hours and do it. Now some people are going to find, were you going to say something, Bob?
no, I was just gonna say, you're looking for more help. I mean, if you're looking for more help,
Oh!
I was gonna give them.
I need a lot of help.
Yeah, you need a lot of help.
Right. If you need more help, this information, it doesn't seem to make sense, which is not too unusual. Go to bobandbrad.com. We have a sciatica program.
Find the program section.
Yes. Go ahead. You do
And
this
under
much
the
better
programs,
than
you will find a number of program titles. One is sciatica
Mhm.
and back pain. Check that one out. We probably, 40,
40.
50, 50,
There's 40.
40
I counted.
videos. 40 videos on back pain and sciatica alone.
Right.
Check it out. You can get answer. Watch the ones that only pertain to you.
Yeah. You just look at the titles. You'll know if it pertains to you. You're probably only going to need to watch a few of them. And then look at them. There's a PDF printout, which is a big bonus. So you have a review of the whole video with the
You
exercises
can take it
on
with you, and,
Yep.
and you can do the exercises without having your computer or
Right.
phone with.
And I never ask, how much is this going to cost?
Yeah.
Absolutely nothing. We don't even ask for an email. It's very convenient and it's all for you. It's a gift from us.
Yeah, that's right.
And
It's, your birthday's probably coming up, right?
somewhere in the next 365 days.
Yeah, all right.
Take care
Yeah,
and take
thanks for
good luck with
watching.
that back.